Only about 1 in 20 people who suffer a cardiac arrest outside of a hospital survive. We'll tell you about a Cone Health project designed to improve your odds. Plus, telepsych services move in-house. Those stories and more in this month's Code View. Most people who have a heart attack in North Carolina don't live long enough to make it to the hospital. Cone Health hopes to increase your chances of surviving sudden cardiac arrest by teaching as many people as possible how to do hands-only CPR. The Heart and Vascular Center has joined with Guilford County EMS to teach hands-only CPR at houses of worship and public events such as baseball games. They're also giving out free kits to people who promise to teach others.
So if I teach you and I give you a kit, I want you to take it home to your family, teach your church, teach your community, your neighbors, as many people as you can reach out and teach.
The Heart and Vascular Center recently received a $5,000 grant from Race Cars and Heart Rescue Project to buy the CPR kits. When someone needs a psychiatric consultation in a Cone Health ED, technology now links that patient to a Cone Health provider. For the past couple of years, telepsych services were provided by an outside company.
So we have our own providers who know our patients better, they know our resources better. We think we can do that service overall better and be more beneficial to our community and to our patients.
The telepsych services are provided by Cone Health Therapeutic Triage Services, formerly the ACT team. They serve Women's Hospital and all Cone Health emergency departments, except the one at Alamance Regional Medical Center. That department makes the switch next year. A little saliva goes a long way toward good behavioral health. Cone Health Behavioral Health Hospital is now collecting genetic material of some depression patients. The material is taken from the saliva, it is tested, and it will tell the doctor what 2 or 3 antidepressants may best work for the patient.
It really changes how you practice medicine, and you get a better response and patients feel better and they have less side effects, which I think is a win-win.
The testing also finds which medications may have the fewest side effects. That means patients may be more likely to keep taking them. The Women's Only 5K Walk and Run takes place Saturday, November 22nd. This year you can find something for the guys at the Women's Only. They can make their support of the women in their lives formal by joining the Women's Only Men's Support Team.
Well, every year, Doug, what we hear is, guys want to participate. Why can't we run? Why can't we be in the race? Why is it only for the women? So we've listened to them for many, many years, and we said, you know what, we need to do something because really it's a support network. And when it comes to cancer care, it's about the support network to take care of a person.
Costs $30 to join the Men's Only Support Team. They receive a special t-shirt and a bag. Guys can register by going to womensonlyrun.com. In July, we told you about the Cone Health Inclusion Council's efforts to collect children's books for Center for Children patients. The book drive has ended, and there'll be a lot of happy kids.
The idea behind the library is not to have just books there. The idea is to actually give these books out to the children that come for the services at Center for Children.
Research finds that parents are more likely to read to their children if a doctor suggests it. If you would like to donate new or gently used children's books, contact Inclusion Council at conehealth.com. That's it for this edition of Code View. I'm Doug Allred, and we'll see you next month.